This type of pump is simple, quiet, and perfect for home or travel. Let's get started. Step 1. Wash and prepare, 20-40 seconds. First, wash your hands thoroughly with soap and water. Make sure all parts of the breast pump, the flange, bottle, and handle, are clean and completely dry. A clean pump helps keep your breast milk safe for your baby. Step 2. Get comfortable 40-60 seconds. Sit or stand in a comfortable position. Try to relax your shoulders and take a few deep breaths. Feeling calm helps improve milk flow. Step 3. Correct pump placement, 60-90 seconds. Place the breast pump gently over your breast, making sure your nipple is centered inside the flange. The pump should feel comfortable, never painful. If it feels uncomfortable, adjust the position. Step 4. Press and release, 90-140 seconds. Slowly press the handle and then release it. Start with gentle, slow pumps, similar to how a baby begins nursing. Once milk starts flowing, continue with a steady and comfortable rhythm. Step 5. Switch sides, 140-170 seconds. When the milk flow slows down on one side, move the pump to the other breast. Pumping both sides helps maintain a healthy milk supply. Ending in tips, 170-200 seconds. After pumping, store the milk in a clean container. Wash all pump parts and let them air dry.